COVID-19 is driving an incredible amount of change happening right now in our day-to-day lives, and that has led to a ton of questions about how to stay safe and how to stay healthy. So every night, we're turning to a team of doctors to help find some answers. With me tonight, respirologist Dr. Samir Gupta and Dr. Isaac Bogosh, an infectious disease specialist. Hello, gentlemen. Thanks again for joining us. Dr. Bogosh, let's start with this first question. And this is one, I got to say, that we've gotten an awful lot. Here it is. Should you be social distancing from your own partner or your own spouse if you live in the same house but are still going to work regularly, still going outside?
Yeah, I mean, it's a bit of a judgment call. And I think that different people have different risk thresholds. And of course, if you're both very, very careful at your place of work and you're both being mindful of hand hygiene and you're both clearly without any symptoms, many people are choosing to have some degree of normalcy in their life and still maintaining the same household relationship that they did before this. Certainly, some other people are choosing not to do that, and that's okay. And some people have been sleeping in separate bedrooms. But I really think that it's totally reasonable to have some sense of normalcy in the relationship at home. And if both people are completely healthy and well, I think that's totally fine.
Okay, Dr. Gupta, this next question is about what happens once you get home. So do I need to wash my hands regularly and repeatedly while I'm at home, or only after I've had contact with the outside world?
Yeah, I mean, theoretically, the time that it's most important is when you've had contact with the outside world. But even if you haven't had that contact, it's a great habit to get into. And, don't forget that there are other infections than COVID-19. So it's a good habit to get into to protect yourself against all sorts of infections.
Right, fair enough. And I suppose odds are you're much more likely to get sick from those other infections than COVID-19. Dr. Bogosh, next question for you. If I've mainly been staying at home alone, is it safe to meet up with other people who've also been staying home alone?
The short answer is we really shouldn't be doing that. And really, we've heard time and time again from our senior public health leadership that we've got to stay home, spread out. But having said that, I think it's totally okay for people to, get some fresh air, go outside for a walk, as long as you keep your distance from other people. So if two people want to maybe go for a walk together, but they're far apart from each other and they want to go outside and get some fresh air, that's totally reasonable. But, I think the real key thing is no congregations of groups of people. And even if there's two people together, let's keep that 2-meter distance.
Okay. Dr. Gupta, this is about the 2-meter distance, especially for people who live in condo buildings or apartment buildings. How long can this coronavirus stay airborne if someone coughs or sneezes? And I'm thinking in an elevator, say.
Okay, well, I think the first thing to be really important to clarify here is that I think there's some confusion because of a study that came out recently that showed that the virus can actually be suspended in the air, but that was actually a study where they used a medical device called a nebulizer. So that was really not about everyday real-life conditions. That was about conditions in a hospital with specific equipment. So in your everyday scenario, people coughing or sneezing, it doesn't actually get suspended in the air. It simply travels in these droplets. And these droplets will, they'll hit a surface or they'll land on the ground, but they won't stay suspended in the air. So, if you're in an elevator, again, it's hard to be 6 feet away from someone. Ideally, they should be facing in a different direction when they cough or sneeze so that the droplets will go in that other direction. But I think the thing to be most mindful of in an elevator type of situation is that all those surfaces are likely contaminated, particularly the buttons. So again, it comes back to hand hygiene.
Okay, Dr. Bogosh, one more question. How will this virus eventually stop? Does it just die out and disappear?
Yeah, the short answer is no one really knows, and there's certainly a lot of speculation here. One of the prevailing theories is that, we're clearly in the midst of a pandemic. The virus is going to run its course, and then it'll likely circulate just on very low levels, maybe with some seasonal variability like influenza. And maybe we'll see some of this virus in the cooler winter months, and then it'll go away in the summer months, and it'll just sort of pass like influenza season, like we see with influenza. No one's 100% sure, but really this hammers home the point that we really need a vaccine for this virus, and tons of efforts are being poured into creating a vaccine for this, so we have a sustainable long-term solution.
All right, Dr. Bogosh, Dr. Gupta, we'll leave it there. Thanks so much for your time.
Thank you.
Thank you.